For most of human history, losing a hand, foot, arm, or leg in battle was not simply a terrible injury. It could be a death sentence. The first enemy was the wound itself, but the next enemies were blood loss, shock, infection, and everything that happened after the fighting stopped. And yet some people survived. They lived for years with missing limbs, returned to work, raised families, and sometimes even went back into battle. The surprising part is that ancient people were not completely helpless when faced with catastrophic injuries. They had no antibiotics, no blood transfusions, no modern anesthesia, and no understanding of bacteria, but physicians and ordinary soldiers developed practical methods for keeping severely wounded people alive. The first problem was immediate: blood. If a major artery was severed, a person could lose consciousness and die very quickly. Ancient surgeons understood the urgency even though they had no concept of the circulatory system as modern medicine describes it. They learned through experience that bleeding had to be controlled. One of the oldest surviving medical documents, the Edwin Smith Surgical Papyrus from ancient Egypt, contains detailed observations about traumatic wounds, including injuries to the head, neck, chest, and limbs. The text dates to around the 17th century BCE, although it was probably copied from an older tradition. Its language is strikingly practical. Instead of treating every wound as a supernatural punishment, the physician was encouraged to examine the injury, determine its severity, and decide whether treatment was possible. Some injuries were considered treatable, others were judged too severe. That distinction mattered. A wounded soldier who had suffered a catastrophic limb injury might first need to survive the initial hemorrhage. Ancient Egyptian medical practice included pressure, dressings, and various substances applied to wounds. Honey, for example, appears in Egyptian medical recipes and was used on wounds. The reason it sometimes helped was not magic. Honey can inhibit the growth of many microorganisms because of its high sugar concentration and other chemical properties. The Egyptians did not know microbiology. They simply observed what happened. Centuries later, Greek physicians developed an increasingly systematic approach to traumatic injuries. Hippocratic medical writings from the 5th and 4th centuries BCE contain extensive discussions of wounds, fractures, dislocations, and surgical procedures. The physicians behind these texts did not have modern trauma centers, but they understood something fundamental. A wounded body had to be stabilized. A broken limb could be immobilized. Bleeding needed attention. Damaged tissue had to be treated, and the patient had to be watched for changes. This sounds obvious today. In the ancient world, it was revolutionary. The Greek physician did not always try to perform a dramatic operation immediately. Sometimes the best treatment was simply to keep the patient alive and allow the body to recover. That became especially important when a limb was so badly damaged that removing it appeared to be the only option. But amputation was dangerous. Cutting through a major limb created a huge wound, and without modern surgical tools or sterile technique, infection was a constant threat. The surgeon therefore faced a brutal calculation: leave a crushed or gangrenous limb attached, and the injury might destroy the rest of the body. Remove it, and the operation itself might kill the patient. Ancient medicine had no laboratory test to make that decision. The surgeon relied on appearance, smell, tissue condition, fever, pain, and experience. When tissue had clearly died, particularly when severe infection or gangrene was involved, removal could sometimes save a person's life. But battlefield medicine had another problem. The patient might not reach the surgeon in time. Ancient armies therefore developed systems for removing wounded soldiers from the battlefield. The famous Roman military organization later became particularly effective at this. Roman armies employed medici, military medical personnel, and established treatment facilities within military camps. Archaeology has uncovered evidence of organized Roman military hospitals, known as valetudinaria, at several sites. That meant a wounded soldier could sometimes move from battlefield chaos into a dedicated medical environment. It was not modern emergency medicine, but compared with having a sword wound treated beside the battlefield, it was a major improvement. And that difference could determine whether a missing limb became a permanent disability or a grave in the ground. One of the most important changes in ancient battlefield medicine was learning that the operation itself was only half the battle. Keeping the patient alive afterward was harder. Imagine surviving a devastating limb injury, only to face the next several days with an open wound, contaminated clothing, dirt, insects, and no antibiotics. Even if the surgeon successfully controlled the bleeding, infection could turn a survivable injury into a fatal one. Ancient physicians could not see bacteria. They could see what infection did. A wound became swollen, the skin changed color, foul-smelling discharge appeared, The patient developed fever and weakness. Sometimes the tissue began dying. Greek and Roman medical writers described these complications and attempted different treatments. Wounds were cleaned, dressed, drained, and sometimes packed with materials intended to protect the injury. The exact effectiveness varied enormously. Some practices probably helped, others probably did nothing. Some may even have made things worse. Yet the basic principle was slowly emerging. The condition of the wound after surgery mattered just as much as the operation itself. Roman military medicine took this knowledge into an environment where injuries were common and predictable. The Roman army was not simply a collection of soldiers fighting battles. It was a logistical machine capable of transporting food, equipment, engineers, and medical personnel across enormous distances. That organization mattered when soldiers were wounded. A man who lost a limb did not necessarily have to disappear from Roman society. If he survived, he could potentially receive continued support from his community, family, comrades, or the military system. And that brings us to something modern people often misunderstand. Survival did not mean returning to normal. A person who lost a leg might never walk the same way again. Someone who lost an arm might permanently lose the ability to perform certain work. But humans are extraordinarily adaptable. A body missing one limb could still learn new movements. A veteran could use the remaining hand for tasks once performed with two. Tools could be modified. Daily routines could change. The person had to relearn life, and some did. Archaeology gives us something written records cannot. Bodies. Ancient skeletons sometimes preserve unmistakable evidence that a person survived a devastating injury for months or even years. Bone does not heal instantly. When a serious injury damages bone but the person survives, the skeleton can gradually remodel itself. New bone forms around the damaged area. The shape changes. The injury leaves a permanent signature. That means archaeologists can sometimes distinguish between an injury that killed someone immediately and one that the person survived. The difference is crucial. A clean break with no healing suggests death occurred before the body could repair itself. Evidence of substantial bone remodeling tells a different story. That person lived, perhaps for months, perhaps for years. In some cases, archaeological remains show that people survived major amputations long before modern surgery existed. One remarkable example comes from prehistoric France, where researchers identified an individual who had survived the surgical removal of part of the forearm thousands of years ago. The bone showed evidence of healing, meaning the person remained alive long enough for substantial recovery. The operation itself must have been extraordinarily difficult. There was no modern anesthesia. There were no sterile operating rooms. There were no antibiotics waiting afterward. Yet somebody performed the procedure and somebody cared for the patient afterward. That changes how we imagine prehistoric medicine. Ancient surgeons were not operating with modern knowledge, but neither were they simply helpless people watching injuries happen. They observed the human body closely. They learned from previous cases. They developed techniques. And when a patient survived, that survival became knowledge that could be passed to the next generation. The written record is incomplete. The skeleton sometimes fills the silence, and the bones can tell us something astonishing. People were surviving injuries that should seem almost impossible without modern medicine. For an ancient surgeon, controlling bleeding was one of the most important skills imaginable. Before modern surgery, there was no blood bank, no transfusion service, and no machine monitoring a patient's blood pressure. If someone lost too much blood, there was very little a physician could do once the body began shutting down, so surgeons relied on direct methods. Pressure was one of the simplest. A tightly applied dressing could compress damaged vessels and reduce bleeding. Packing a wound could sometimes create enough pressure to slow hemorrhage. Binding or tying off blood vessels was another technique that became increasingly important in later surgical traditions. The principle was brutally simple: stop the blood from leaving the body. Ancient physicians also understood that different wounds behaved differently. A small cut was not the same as a deep injury involving a major vessel. A damaged limb could sometimes be saved, while a completely destroyed extremity might have to be removed. The decision demanded judgment. Too little intervention could cost the patient their life. Too much could do the same. This is where ancient surgery becomes surprisingly sophisticated. The physician had to understand anatomy through observation. Greek and later Roman physicians described muscles, bones, nerves, and blood vessels with increasing precision. Although many anatomical ideas remained incorrect by modern standards, the Roman physician Galen, working in the 2nd century CE, became particularly influential. His writings on anatomy and surgery shaped medical thinking for more than a millennium. But Galen's influence also demonstrates the limits of ancient knowledge. Because human dissection was restricted in his time, much of his anatomical knowledge came from animals. Some of his conclusions were therefore wrong, yet his descriptions still preserved an enormous body of practical medical knowledge. Ancient medicine was neither modern science nor pure superstition. It occupied an uncomfortable middle ground. Some techniques were remarkably effective, others were based on mistaken ideas. The difference between them was discovered slowly, through generations of patience. Then came one of the most dangerous stages of all, amputation itself. A surgeon who decided that a limb had to be removed needed speed, control, and extraordinary precision. The longer the operation lasted, the longer the patient remained exposed to blood loss and shock. Ancient surgical instruments were designed for exactly this kind of work. Archaeological discoveries from Roman sites include scalpels, forceps, bone saws, hooks, needles, and other specialized instruments. Their forms are surprisingly recognizable to anyone familiar with modern surgical tools. The resemblance does not mean Roman surgery was modern. It means the physical problems of cutting tissue, controlling bleeding, and manipulating bone have not changed. The instruments had to do the same basic jobs. A saw had to cut, a clamp had to grip, a blade had to slice, a needle had to close tissue. The biggest difference was everything surrounding the operation. Modern surgery depends on anesthesia, sterile technique, antibiotics, blood replacement, intensive monitoring, and advanced imaging. Ancient surgeons had none of these. Pain was unavoidable. In some societies, substances with sedative or analgesic properties were used, including preparations derived from plants such as opium poppy. But controlling pain was limited, inconsistent, and dangerous. The patient might be conscious throughout the procedure. Imagine what that meant. The sound of the instrument, the pressure of hands, the smell of blood, and the knowledge that there was no emergency room waiting if something went wrong. Yet operations were performed. Some patients died, some survived, and the survivors carried the evidence of what ancient medicine could accomplish. Their healed bones are a record of resilience that written history rarely mentions, because the most important story is not always the battle. Sometimes it is what happened afterward, when someone had to learn how to live with the body that remained. The Roman army eventually developed something ancient warriors desperately needed, a system for dealing with casualties before they became corpses. Roman military camps were carefully organized, and medical facilities could be placed within them. Archaeological excavations have identified structures interpreted as military hospitals or valetudinaria at several Roman sites. Inside these facilities, wounded soldiers could receive treatment away from the chaos of the battlefield. That mattered enormously. A soldier who survived the initial injury could still die from infection, dehydration, blood loss, or complications. Moving him into a controlled environment gave physicians a better chance to monitor the wound and provide food, water, dressings, and continued care. The Roman military also employed specialists who treated injuries rather than leaving every wounded man to whatever help happened to be available. This did not eliminate battlefield deaths. Far from it. Ancient warfare remained brutally dangerous, but organization changed the odds. The same principle appears repeatedly throughout military history. Medical knowledge matters, but medical logistics can matter just as much. A brilliant surgeon is useless if the wounded never reach him. A clean dressing is useless if nobody has one. A medical facility is useless if soldiers cannot be evacuated. Ancient armies slowly learned these lessons through experience. And when a soldier survived a severe injury, his survival could become valuable knowledge for the next wounded man. There was another challenge nobody could ignore. What happens when the war ends? For a soldier who had lost a limb, surviving the battlefield was only the beginning. Ancient societies did not have modern prosthetic limbs as we know them, but people still created ways to compensate for physical loss. Archaeologists have discovered ancient prosthetic devices, including artificial limbs designed to replace missing body parts. One of the most famous examples is the Capua leg, a Roman-era artificial leg traditionally dated to around the first few centuries BCE. The original was destroyed during World War II, but a replica survives and gives researchers an idea of its construction. It was made primarily from wood and reinforced with bronze components. That alone tells us something important. Someone had designed a device specifically for a human body that no longer had its original limb. The goal was not cosmetic perfection, it was function. Walking, standing, moving. Other ancient prosthetic devices have been identified in Egypt and elsewhere, although researchers sometimes debate whether certain examples were functional prostheses or symbolic replacements intended for burial. That uncertainty is important. Archaeology does not allow us to turn every strange object into a medical device, but the securely identified examples demonstrate that artificial body parts existed long before modern medicine, and adaptation went beyond prosthetics. A person missing an arm could modify tools. A person missing a foot could use supports. Families could change work assignments. Communities could provide assistance. The human body was not treated as an all-or-nothing machine. If one part was lost, people searched for another way to accomplish the same task. That instinct is ancient, and it may be one of the strongest reasons some survivors were able to return to meaningful lives after injuries that would have seemed catastrophic to their contemporaries. There is a darker reason some ancient soldiers survived wounds that seem impossible to survive today. They were sometimes lucky, not skilled, not protected by extraordinary medicine. Lucky. A sword could strike a limb without completely severing a major artery. A spear could shatter bone while missing the largest blood vessels. A crushed foot could be removed before infection spread. A wound could become contaminated and somehow heal instead of turning fatal. Small differences determined enormous outcomes. Two soldiers could receive apparently similar injuries and experience completely different futures. One might die within hours. Another might live for decades. Ancient physicians understood this unpredictability even if they explained it differently. They knew that some wounds healed while others deteriorated rapidly. That uncertainty made battlefield medicine an exercise in judgment. A surgeon had to decide which patient needed immediate attention. Who could wait? Which limb might be saved? Which limb was already beyond recovery? And sometimes whether an operation was worth attempting at all. The stakes were enormous. What makes the archaeological evidence especially powerful is that healed injuries reveal something written sources often hide: survival. A historian may record a famous battle and name the generals, but rarely mention the ordinary soldier who lost a leg and lived another 30 years. Bones can reveal that missing story. Healed amputation surfaces, remodeled bone, changes caused by long-term altered movement, and other skeletal evidence can show that an individual survived serious trauma. Some survivors probably returned to ordinary work. Others may have depended heavily on relatives. Some may have received assistance from military communities or religious institutions. There was no single experience. Ancient societies were as varied as modern ones, but the biological challenge remained universal. A person had to stop the bleeding. The wound had to remain viable. Infection had to be avoided or overcome. The body had to heal. And then, the survivor had to adapt. That final stage is often forgotten. Modern discussions of traumatic amputation focus heavily on surgery and prosthetics. But surviving physically was only the beginning. Losing a limb changed balance, strength, mobility, and the ability to perform familiar tasks. The survivor had to relearn movements that had once been automatic. Walking became a skill again. Work had to be modified. Tools might need to be redesigned. Life had to be reorganized around the injury. And yet, humans did it, again and again. Across prehistoric settlements, ancient kingdoms, Greek armies, Roman camps, and later battlefields, people discovered that survival did not require returning to the body they had before. It required learning to live with the body they had left. That may be the most remarkable part of the entire story. The ancient battlefield could take a person's limb in seconds, but it did not necessarily take the rest of their life with it. There is one final fact that changes how we should imagine ancient battlefield medicine. Surviving a severed limb was never a single medical achievement. It was a chain of victories. First, the wounded person had to survive the moment of injury. Then someone had to control the bleeding. The patient had to be transported without dying on the way. A surgeon had to decide whether the limb could be saved or had to be removed. The wound then had to avoid catastrophic infection long enough for the body to heal. And after all of that, the survivor still had to rebuild a life. Break any link in that chain, and the story could end very differently. This is why ancient medical history cannot be reduced to a list of strange remedies or primitive surgical tools. The real achievement was practical knowledge accumulated over generations. Physicians learned to recognize dangerous wounds. Soldiers learned how to carry the injured. Communities learned how to care for disabled survivors. Craftsmen learned to create devices that could compensate for missing body parts. None of these developments required an understanding of modern trauma physiology. They required observation. A physician did not need to know the molecular mechanism of infection to notice that a contaminated wound was more likely to become dangerous. A surgeon did not need modern anatomy textbooks to understand that cutting through a major vessel could cause fatal bleeding. A craftsman did not need biomechanics equations to realize that an artificial foot had to support the body's weight. Ancient people learned through consequences. Sometimes the lesson arrived too late. Sometimes it saved the next patient. The battlefield has changed enormously since antiquity, but the central problem has remained the same. A weapon can destroy the body in an instant. Survival happens slowly. That contrast explains why the ancient survivors of catastrophic injuries deserve more attention than they usually receive. They were not invincible warriors. They were ordinary human beings who experienced extraordinary trauma, and somehow continued. Some were soldiers. Some were civilians caught in violence. Some suffered accidents rather than war. Their stories rarely appear in the grand narratives of kings and empires, yet their healed bones can remain thousands of years after their names disappeared. A missing limb could become a permanent record of survival. The scar that ancient surgeons left behind was not merely evidence of what had been removed. It was evidence that the person had lived long enough for the body to repair itself. That is the part worth remembering. Ancient people did not have antibiotics to fight infection. They did not have transfusions to replace massive blood loss. They did not have modern anesthesia to make surgery painless. They did not have intensive care units waiting beside the operating table. And still, some survived injuries that could have killed them within minutes. Not because ancient medicine was secretly equivalent to modern medicine. It wasn't. The mortality was devastatingly high. The treatments were inconsistent. The risks were enormous, but human beings are remarkably difficult to reduce to statistics. Someone always survived. Someone healed. Someone learned to walk again. Someone returned to work. Someone raised children with a body permanently changed by violence. And somewhere beneath the soil, the skeleton of that person may still be waiting to tell the story. The weapon destroyed a limb. It did not necessarily destroy a life, and thousands of years later, the healed bones are still there to prove it.